In most Eastern medicine, boosting your child's immune system begins with supporting their digestive tract. Children have an elevated need for nutrients and wholesome foods to support their accelerated growth. Generally, when I meet a child, I'll start by assessing how effectively they are absorbing this food. One important way I do this is by observing their bowel movements. By the time a child has progressed through infancy, you may already have observed changes in color, consistency, odor, and frequency. Some variation in stools is normal. When you start noticing patterns developing, however, that may indicate a digestive problem. Examples of problems would be a tendency toward constipation, loose stools, undigested food in their stool, pain in the belly when passing a stool, lots of gas, or alternating diarrhea and constipation. Consistent foul smell to your child's poop. For any of these conditions, I suggest checking out the sections on diarrhea, constipation, and stomach aches. And of course, checking with your pediatrician or primary caregiver. Even if your child does not have recognizable digestive difficulties, however, I still recommend paying special attention to digestive acupressure and massage techniques to improve their digestive systems. In doing so, you're strengthening their immune function. You may be surprised at the beneficial results. To strengthen your child's immune system, I recommend doing basic digestive massage techniques daily. Parents can use the digestive massage techniques of spinal rolling, tummy circles, and belly massage, also acupressure. Have your child lie down on his or her stomach. They can leave their top on or take it off however they feel the most comfortable. If they take their shirt off, you might want to rub some oil or lotion onto your hands and their back to avoid any chafing. Start at the top of the neck and firmly but gently grab the skin and muscle at the base of their neck as though you are gently about to knead some dough. Rolling your fingers forward toward you, gently work your hands all the way down your child's spine, continuing the grab, roll, and release. Repeat this process at least 3 times going downward. If your child finds this technique in any way uncomfortable, you can also take the pads of your fingers and just massage down the sides of your child's spine, about 1 inch to 1.5 inches away from the spine. In acupuncture, this still hits points corresponding to every organ system in the body. Also, feel free to do your own combination of the 2 techniques and take some time with it if your child is finding it relaxing. My son enjoys it for about 10 minutes. Some of my clients like their parents to do this every night before they go to bed. It is great for their immune system, so that's up to you. Spinal rolling and spinal massage serve the really nice and important function of relaxing your child. They also stimulate your child's central nervous system. All organs in the body connect up to the nerves exiting your spinal cord. So in essence, what we're doing is stimulating every organ in the body to function optimally. Additionally, you're encouraging lymphatic flow. Finally, this technique accomplishes a lot. You're affecting your child's autonomic nervous system, the system in your body that's responsible for a lot of automatic functions, including immune response and mucus production. In my experience, the results of these techniques are maximized by consistency. Just 5 to 10 minutes daily can make a huge difference. Have your child lie down comfortably on his back. Then, with the pads of your 4 closed fingers or the palm of your hand, gently push while rotating your hand to make medium-sized clockwise circles around your child's belly button. Continue in a clockwise direction 50 to 100 times, or for a few minutes. You can follow this motion by gently pushing your hands apart along your child's belly for another few minutes, or 50 to 100 times. My son has always loved to receive tummy massage, and to give it. When he was little, he would call it belly-sage. Press with firm but gentle pressure on the area about 4 of your child's finger breadths beneath the bottom of their bent kneecap, right against the tibia bone on the outside of their leg. You can use the pad of your thumb. You may feel a palpable indentation here up to the size of a dime. Rub here for at least a few minutes on each side, or both sides together, as long as your child will allow. This point has a myriad of wonderful physiological effects on the body, including improved digestion, and bolstered immune function. I have heard stories of wonderfully active 80-year-old Chinese women who still stimulate this point every day. All of these techniques help to regulate the digestive system and the bowels. That's why we use them so often throughout the DVDs. They also improve autonomic nervous system functioning, the system which is responsible for regulating your child's and your own immune functions. We encourage parents to incorporate some or all of these techniques into your child's nightly routine, much like brushing their teeth 5 to 10 minutes a night. There's some other basic mealtime suggestions that can improve your child's digestive and immune health. I recommend that meal times are as calm as possible and that children are expected to sit down to eat. I also recommend that parents reduce snacking. Constant snacking requires that a kid's digestive system is constantly working. Focusing on fixed, regular meal times helps to regulate the digestive system. Another easy way for parents to help support their child's system is to provide warm cooked foods at meal times on a regular basis, especially if your child is frail, pale, tend towards loose stools, or is recovering from illness. Children's digestive systems are not up and running like an adult's, so they may not be effectively breaking down food without some help from your oven or stove. The way Chinese medicine looks at it is that the breakdown of food creates energy in the body, but it also requires energy to digest. In particular, if your child's system is tired from illness, fatigue, or is showing signs that it's having trouble breaking down food on its own in the form of loose stools, gas, bloating, undigested food in the stool, offering your child cooked, bland foods can help them to rebuild without expending energy on digestion. Grandma was on the right track when she made up chicken soup. If your child tends to be more robust, however, to run hot, be sweaty, red in the face, maybe even tending toward constipation, including some raw veggies, salads, seeds, and nuts, may have a more beneficial and even cooling effect. A nutritionist versed in Chinese medicine or Ayurvedic nutritional healing may be able to give you more specific suggestions for your child's constitution. You may also consider incorporating digestive enzymes with your child's meals. My favorite that I've worked with for children are Ness enzymes, but there are many more. Please consult with your health food store or practitioner for suggestions. You can have your child take them immediately after eating to improve food breakdown. Or I've known parents to break open capsules of enzymes and sprinkle them directly onto their child's food. If your child has a history of low immunity, I like incorporating a high-quality buffered vitamin C supplement taken to bowel tolerance. This means if your child's poop gets loose when she takes the vitamin C, reduce the dosage. Probiotics, whether from yogurt or in supplement form, can also play an important role in bolstering your child's digestive health and immunity. Some research suggests that children with high levels of lactobacilli and bifidobacteria in their intestines, the good bacteria found in many probiotics, are less likely to get infections than those with suboptimal levels. Levels can get low from heredity, diet, illnesses, history of frequent antibiotic use. As I mentioned in a different section, probiotics may also be added to your child's bath water for some gentle exposure to them. If your child is recovering from illness, looking frail, or suffering from lowered immunity, you may also try giving them royal jelly, up to 75 milligrams for 50 pounds of body weight. Royal jelly, the food that transforms a worker bee into a queen bee, thereby living 20 times longer, is considered by some nutritionists to be one of nature's most perfect food sources. If your child is having any food issues with malabsorption or malnutrition, this may prove particularly effective. A word on supplements here. Not all supplements are created equal. I love these immune-enhancing suggestions in general, but some forms of vitamins and nutrients are more bioavailable and easy for your child's body to break down and assimilate. Please ask your practitioner or nutritionist for suggestions. A reputable health food store may also prove to be a good resource.